things that you shared in your opening remarks was partnership, and clearly that is what we are here. That's what the fruit of our labor thus far in our journey has brought us to. It is certainly a pleasure to be with you this afternoon, and on behalf of Governor Ted Strickland and the staff of the Ohio Department of Alcohol and Drug Addiction Services, which represents a partnership of our local ADAM and ADIS boards as well as our behavioral health providers, we say thank you. Now, we know arriving to this point has not been without tremendous effort. We say thank you for the opportunity to have the Justice Reinvestment Project in the state of Ohio. We know that this came with the work and the collaboration of 3 branches of government. We say thank you to Chris Long from the governor's office, to Justice Stratton from the Supreme Court, Representative Moran, and Senator Sight from the legislature. We know that it will be upon our shoulders to carry out the work that the data will reveal. We are appreciative of the partnership with the Pew Center as well as with BJA and Council of State Governments. One of the realities is that we've been working for this past year to find a data-driven process that will help us develop a statewide strategy for a policy framework that will get at the very core of the issues that we are talking about today. Why would this issue be important to Ohio? You've already known and heard full well about the process that has brought us to this point, and that is the expenses in our system that can be more efficiently and more effectively relegated so that we can have safer communities and people can have access to services that are needed. An examination of the impact of addiction in the nation's bottom line will help illuminate for us why it's critical to promote greater efficiencies and reinvest our savings wisely. According to the National Institute on Drug Abuse, in 2009, alcohol and other drug abuse cost Americans an upward of $500 billion, considering their combined impact in our medical, economic, criminal, and social impacts within our communities. This Justice Reinvestment Initiative has specifically focused on the corrections population and the collaborative work that can be done to improve our investments. None of us in this room are surprised about the connection between criminogenic behavior and addiction. As it has been clearly articulated in this morning's presentation by Dr. Fabello and Dr. Latessa, we know that individuals with substance abuse disorders, mental illnesses, and a combination of the two are overrepresented in our criminal justice populations. The data that has been shared has demonstrated that over 70% of the population within our prison system have an underlying substance abuse and/or addiction issue. ODADIS is clearly aware that we have to break the cycle of addiction and crime. Part of our mission is to provide access to treatment services to interrupt this cycle. Nearly 40% of our budget is directed to individuals who are involved in the criminal justice system. Effective treatment is absolutely needed to help individuals stop drug use and return to a productive lifestyle. We know that drug treatment has been proven to cut drug use in half, reduce crime by 80%, and reduce arrests by 64%. Nationally, the cost of drug treatment is 15 times less than the cost of incarceration. However, we recognize that treatment must be readily available to have its true impact. The work of the Justice Reinvestment process has clearly provided a foundation to strengthen access to addiction services as a strategy that other states have been proven to be effective in reducing recidivism. This report will provide a sound basis for making key decisions that will lead to multiple improvements within our systems overall. As partners at the table, we can foster solutions that are feasible in the current financial climate so that we can build stronger partnerships that result in healthier communities. ODATIS is more than proud to partner with everyone in this room as we bring about more efficiencies and explore cost-saving solutions that will close the revolving door of addiction and crime. The data will speak for itself. We must determine if we will listen and, more importantly, if we will respond. Presenting with me today is not my partner in crime, but my partner in healing. Sandy Stevenson with the Ohio Department of Mental Health works daily to make sure that individuals who are in need of access to mental health services in the state of Ohio have the level of access that they need. Director Stevenson.